And Health Minister Patty Hajdu joins us from Thunder Bay today. Hello, Minister. Nice to see you. Thanks for taking the time to talk to us. I just want to ask you about vaccines. So the Prime Minister today announced $214 million for a Made in Canada vaccine. So I want to do a little bit of a reality check with you. Maybe let's try to reality check Donald Trump, if it's even possible. He says a vaccine is around the corner, but even Dr. Anthony Fauci says that, you know, by the end of the year, probably the tests will be done. It could be available on a large scale by April. Do we in Canada have such a timeline? Do we know? Is it 6 months? Is it 3 months? Is it 24 months? What can you tell Canadians about the availability of a vaccine here in Canada?
Well, thanks, Joyce. And it's such an important question in terms of setting expectations. I think it's one of the most common questions I get: how long until? And the challenge is it's based on science and research, you know, and the evidence that is being gathered by the producers of the vaccines as they undergo their clinical trials. The good news is that here in Canada, we have 3 of the 6 vaccines that we procured from the major manufacturers that have applied for rolling approvals. And so what that means is they are submitting clinical information as they acquire it so that our regulators can very rapidly assess the information as it's coming in. There are some very optimistic people that feel that we may have an effective vaccine of some variety or another within the first quarter of 2021. But I'll just say this, we in Canada will ensure that whatever vaccine is approved by Health Canada has gone through the rigor that Canadians would expect on safety and efficacy of the vaccine.
I understand that, but this is not Donald Trump, who's not a doctor, and we know that sometimes, you know, reality is not necessarily something he has a good relationship with. But this is Dr. Fauci saying April, it's science. So, you know, American science, Canadian science, you know, science is science. So if they can do it in April, can Canada do it by April?
Well, it's not a question of, can we do it at the same time of the United States? Of course, some of the vaccines that they have procured are going through the same process in the United States, a rolling review. Our processes are very aligned with other regulators. So, you know, listen, if a vaccine is available amongst the 6 that we've so far procured, obviously we have new vaccines on the scene today, Canadian vaccines, but, you know, 3 of them have already submitted for regulatory review. So that's a really good sign. It means that they're getting close to being able to have some certainty that the research and the science that they're accumulating through the clinical trials are showing good promise. So listen, I will leave it to the researchers and the doctors to pronounce their relative comfort, but I can say we're ready in Canada to be able to do that work, and we have already begun with the companies that have submitted for review, and that's good news. The good news is that I can see a light at the end of the vaccine tunnel.
Well, that's good news, you know, going into the weekend. But I want to turn to this Conservative motion to study more deeply the government's COVID-19 response. Now, you have said there are issues with the timing to get the requests, the documents they want, emails, notes, and so on. You know, originally the Conservatives said 15 days. They've extended it to 30 days with the possibility of a further extension. So are you satisfied with this? Can you hand over those documents that the Conservatives and indeed, you know, the Canadians want to see? Are you satisfied with the fact that they're going to give you enough time to get these documents to Parliament?
Well, first of all, I welcome the gesture of goodwill from the Conservative Party. I think it's a reflection of the fact that the original request to produce thousands and thousands of documents in 15 days amongst multiple departments was a bit onerous, if you will, in terms of its scope. And I think, you know, the reflection that they've had that the request was unrealistic is a good one, and it gives us an opportunity to work with the opposition to determine a time frame that is reasonable. I said yesterday in the House that, of course, we would be more than happy to do that, and so those negotiations are ongoing with the House leaders. And from our perspective at Health Canada and Public Health Agency of Canada will provide the documents when the motion is passed.
Okay, but you're waiting for the motion to pass, but are your civil servants, are these departments already putting together, because I imagine you already have these documents must exist. We've been in a pandemic for 8 months. I imagine there are huge files that are already available. Are you making them available right away? Are you starting to put them together to make them available for Parliament?
Well, absolutely. Both departments are doing a thorough job of documentation, as you know, and we'll be working on putting together packages for the Health Committee as per the final terms of the motion. But I'll just say this, Joyce, you know, there's an implication in the motion that we haven't been transparent with Canadians, and nothing could be further from the truth. I personally have appeared in front of the Health Committee a number of times, so has Dr. Tam, so have many officials across multiple departments, as well as provided documents. All kinds of information is online for Canadians, from epidemiological information all the way to what tests and devices are in review with regulators. This is all transparent and available to Canadians. So, you know, listen, we're going to continue to provide that information to Canadians to comply with Parliament, but it does need to be done through the lens of actually making sure that whatever we do does not in any way take away the attention for that I think it needs to be focused on our COVID response right now, and as we support Canadians to stay free of this disease.
I understand. I understand your position, Minister. You put $19 billion on the table, telling the provinces, here, go ahead, it's all yours. And you know, your negotiation was interesting. It was just tell us how much money you want. And we still don't have the right tests we need. We still know that we can't contact trace, which is a huge problem right now. So you gave the provinces the money. I know that you don't handle the tests, but there is a problem, and it is not a money problem. It is an organizational problem, clearly, because you told them the sky's the limit. So is it the provinces that have dropped the ball?
Well, we can see that the experiences across the country have not been the same, and some provinces have not had the same struggles as other provinces, for example. And we know that having a testing strategy is critically important. In fact, we didn't just give the money. That was an important part to make sure they had their systems ready, but we also provided national guidance on a testing strategy, for example. Some provinces chose to deny that, even though they had participated in creating that guidance, they chose to take a different path.
So you're telling me, are you telling me, Minister, that the provinces drop? Because people want to know, and that's probably why sometimes there's the feeling of a lack of transparency, both from the federal government to the provincial government, because we are trying to get tested and you can't get tested, and you're wondering, 8 months into a pandemic, why is it so difficult to go get a test when you need those tests to go back to work? You need those tests for your kids to go back to school. You know this better than I do. So clearly there is a lack of transparency here, because nobody's understanding, how does this happen 8 months into a pandemic?
Well, I think Canadians can ask themselves, when was the last time they went to the federal government to get a test or to get a medical procedure? Never, the answer is. And so, in fact, the provinces and territories have the jurisdiction to deliver health care, which is really, within their responsibility and their power. As a federal health minister, I can do very little about, for example, boosting up labs and the network of labs, or changing the data system in Ontario. So the $19 billion was really there so provinces could not have money as the challenge, that they would be able to actually take that money and then transform it into the systems and networks that they need. And some provinces have done exactly that. Others have struggled to do so.
Okay,
and there's
so
many
which provinces,
reasons.
tell me which provinces have struggled to do that? You call it struggle to do that. I can call it drop the ball. Which provinces have not?
Well, look, I think all provinces have had challenges and successes. Look, these are complex systems and networks that have to be built up. There are human resource challenges, across the country. We've seen challenges with, for example, not having enough healthcare lab techs, for example, or healthcare workers for long-term care. So, listen, I think what we can say is that part of what has helped us is actually working together. for sure, there are things that we could all reflect on and say, let's do this better the next time that we're faced with a global pandemic. But I can tell you the federal government will be there for provinces and territories no matter what. On that note, I'll just say, part of our support has been actually to provide, through a rapid response program, an overlay of extra contact tracing capacity, for example, or funding for isolation housing for sick people, or being able to actually support with some lab testing and analysis. These are the kinds of things we'll continue to do for provinces.
But what the opposition is telling you is, because of all these problems with testing and contact tracing, rapid testing, is probably what we need, but we're not seeing that either.
Well, I think the opposition, again, it would probably do a really, I think Michelle Rempel in particular would do her good to come and get the briefing that I've offered her many times with the department about what a testing strategy looks like. For sure, without a question, we need rapid tests, but rapid tests play a very specific role. And we've had rapid tests, in fact, in Canada for a number of months. We've had, over 70 rapid test kits, if you will, across the country, and for example, rural and remote communities that have been able to help augment the work that provinces and territories are doing. More of this technology is being developed every single day across the world, and we're buying it as fast as we can get it. And I'll tell you, deploying it into provinces and territories so that they can put them in communities or locations that is going to be a best assistance to their testing strategy. But there is not one single solution to managing COVID-19. A test is only a test. You also need to follow up with contact tracing and isolating of close contacts, and the whole system has to work together.
I'm going to have to leave it at that. Patty Hajdu, thanks so much for talking to us. Have yourself a safe and lovely weekend.
Thank you so much, Joyce.